I am going to start and let Maria Casas, who is running for the Provincial Resolutions Committee, to say a few words. Maria, I will give you 3 minutes, and then we will move on to the next candidate. So, Maria, I'll give it over to you at this time.
Okay, thank you, David. So I'll just provide a little bit of my background and my involvement with RNAO. So I have been a member of RNAO for about, more than 23 years now, and I've played an active role in activities of the Sudbury chapter. For much of that time, I've held the position of Policy and Communication E&O, and more recently I was the chapter co-president, but I'm now back in the policy position. I've attended many AGMs, I've participated in the voting process on many occasions. I've also participated in Queen's Park Day and Take Your MPP to Work on many occasions as well. I've worked with the RNAO BPGs in a number of capacities, implementing them in the workplace. I participated as a member of the panel that developed the guideline on preventing and managing violence in the workplace, and I was a stakeholder reviewer for another one. As a nursing leader, I've brought the RNAO Centre in to provide workshops to my registered staff on more than one occasion. And more recently, I volunteered to work with Rhonda Seidman-Carlson to engage the College of Nurses in discussion about nurse fatigue and standards that would address that. From a career perspective, I've been an RN for close to 30 years, and during that time I've held positions in clinical, educational, consulting, and administrative nursing. I've worked in chronic care, medicine, ambulatory care, visiting nursing, rehab, and more recently long-term care. I've been a certified long-term care administrator since 2002 and a certified gerontological nurse since 2009. I sat on the Northeast LHIN Health Professionals Advisory Committee from 2009 to 2013, and I'm now the co-chair of the Northeast LHIN Long-Term Care Hub for Sudbury, Manitoulin, and Parry Sound. I believe that nurses as leaders have a responsibility to influence and shape both nursing practice and health policy, and I'm happy to have the opportunity to do that work through RNAO, and so I welcome the opportunity to continue my participation in this organization and contribute further as a member of the Provincial Resolutions Committee.
Thank you, Marie, for those comments. We will allow the questions to be answered after everybody has had the opportunity to submit their questions and that all of the candidates have had an opportunity to speak. Penny, can you let me know if both of the candidates are now online for the member-at-large for nursing practice?
Allison is certainly online. Meredith, are you online?
Yes, I am.
Wonderful. Thank you.
Just to reiterate the House rules at this time, that Meredith, just to make sure that you heard them, each of the candidates for the member-at-large for nursing practice will have the opportunity to speak for 3 minutes. We are doing the speaking in alphabetical order. So I will ask Allison if you would please take a few minutes to share some of your thoughts. Thank you, Allison. Go ahead.
Hi. Again, my name is Allison Kern, and I'm currently working as a nursing practice leader within a public health unit in Ontario. And through this job, I have learned a lot and gained a lot of experience about nursing practice across several different disciplines of nursing within public health and within other sectors that I get involved with. I wanted to also provide you a little bit further background, further from the bio that's available to you. I actually started in healthcare in 1992, working as a med lab technician in a Ottawa branch of a med lab laboratory, and I worked there for 13 years, which gave me a lot of insight into healthcare and how organizations and different members of the healthcare team fit together. So I have a lot of multidisciplinary scope as well. I started in nursing, started back to school in 2005 and completed a Bachelor's of Science in Nursing and went on to do a master's degree, which also included an extra graduate diploma in health service and policy research, which really taught us about how to get at the political underpinnings and how to really move our agendas forward in nursing practice and to support our nursing leaders. So through these experiences, I've been happy now to, again, work as a nursing practice lead and work with healthy babies, healthy children, sexual health nurses, immunization competencies, communicable disease and emergency preparedness is a big part of my portfolio, as well as injury prevention and health promotion and tobacco cessation across our agency. These experiences have been broad and they've also been deep, meaning that I have worked across the agency on the ground with nurses on front lines, as well as deep, meaning I have worked at many layers of our organization, from the executive committee to the management to all facets of nursing care. I really believe in nursing leaders and I support nursing to the fullest. One of the parts about being involved in an organization such as the RNAO is it does give us the opportunity to support our nursing leaders and to be proud of the work that we do, and to look also with a lens of nursing practice is important as we strive to look at the landscape of nursing across Ontario. Our landscape is very broad, as you know, but it's also, we have various levels of our landscape in terms of practice and in terms of the clinical skills and nursing processes that we use. Key issues that I'm seeing across the province, again, I've mentioned this in my video, is social media, electronic medical records, medical dispensing, and a huge push towards nursing documentation. So I thank you for listening, and I look forward to being involved in RNAO.
Thank you, Allison, for those comments. I would now ask Meredith if you would be so kind as to provide your comments for 3 minutes. Thank you.
Thank you, David. Thank you for members for giving me this opportunity to speak with everyone today. I would like to take this opportunity to introduce myself. I am Meredith Whitehead, and I am currently a Senior Project Manager for Professional Practice at Mackenzie Health. I have also held multiple roles within practice, being professional practice leader for nursing and clinical nurse educator for 2 large community emerge departments. I'm currently responsible for the development, implementation, and evaluation of projects that promote evidence-based practice, innovation, and professionals working at their full scope of practice, advancing interprofessional collaboration and our patient experience. 2 of the main issues that I currently lead are patient care redesign and patient experience. Patient care redesign is really our process for changing our delivery model of care, ensuring that nurses are working to their full scope of practice and embedding evidence-based practice in our way of being at all levels, from frontline to executive leadership team. Currently, I lead 3 corporate-wide BPGs, client-centered care, establishing therapeutic relationships, and collaborative practice among nursing teams. My involvement with the RNAO started as a nursing student and has continued throughout my career. I have maintained my RNAO since being a student, and as an educator, clinical educator for an emerge department, I started my journey with implementing best practice guidelines by managing our BPSO candidacy for the last 2 years. I have also been privileged enough to participate in the RNAO Advanced Clinical Practice Clinical Placement Fellowship in the leadership stream, and have also been a reviewer for that process for the last 2 rotations. I was also lucky enough to be selected to present my master's work, Communities of Practice, at the RNAO International Conference in Jerusalem, and have presented multiple times at the BPSO Knowledge Exchange Symposium. I am also a current serving member of the RNAO Bylaws Committee. I am exceptionally passionate about practice. I am passionate about ensuring that standards and policies are in place to make sure that nurses do the right thing every time. But I'm equally excited about being able to create the space for clinicians to discuss and explore the concepts of practice. Everything we do in healthcare relates to practice, from quality and risk to our patient experiences. The discussion about practice really needs to occur at all levels of the organizations, all tables, in hallways, and staff rooms. Regardless of our practice setting, space needs to occur for practice to blossom and not be something that's put on a shelf and only spoken to in the realm of standards and policies. This
Meredith,
practices about, yep.
it's 3 minutes, so
Oh, sorry.
I will ask you to wrap up there. And
Sure.
thank you, Meredith, very much for those comments, and I would like to thank all of the candidates for their comments. Now, Penny, I understand that there may be some questions, and probably the best way to proceed with this would be to first start with Marie, and if there is any questions that have been submitted for Marie Casas, who has been running for the Provincial Resolutions Committee. So, Penny, I'd ask you to bring those forward.
Yeah, a member's asking, Maria, how long have you been a member of RNAO?
Just over 23 years.
Thank you.
Are there any other questions for Marie, Penny?
No.
Okay.
We have questions. We have questions now for Allison.
All right. So, could you please proceed with those?
What are your main plans and visions, Allison, if you do get the MAL nursing practice role on the board?
One of my main visions is really to always look at nursing practice within a context of a framework that provides some standardization to the way we look at practice in order to support the various components of nursing in different settings. By applying that nursing framework of person, environment, health, and nursing, we can look at a level playing ground and apply this framework and consider these components of the person, meaning the client or the patient, the environment in which that nursing role or activity or the client-centered care takes place, the health of the individual with as one but also within community, and how we understand nursing within those components are very important. So having strong-based frameworks to support nursing practice, and also to continue to make sure that nursing process is embedded in all of our documentation and really holds strong and true to the underpinnings of our profession, and making this a common language again with nurses so that we are proud to stand up in our workplaces and really maintain good, solid documentation and evidence-based practice that supports these elements.
Thank you, Allison.
Thank you.
Penny, is there any other questions for Allison?
Yes, another member is asking, how long has Allison been a member of RNAO?
Okay, I began to be a member in 2005 when I entered nursing school.
Thank you. And there we actually have another question.
Yep.
How do you? I'm sorry, I just, the linking of the board. The other one about linking. Yeah. How would you link the members in your jurisdiction, if you like, and the board activity?
Oh, that's a good question. So what I would want to do is strive to be a member of my local regional sector here in the area that I live, so that I can maintain those links and ties between the board and my jurisdiction.
All right, thank you, Penny. Are there questions for any more questions for Allison? And if not, we'll move on then to questions for Meredith.
Well, in fact, this question, how would you link the members and the board of directors, was also addressed to Maria, but I'm not sure that has relevance. I'm sorry. I just wanted to make sure the question was asked. We do have another question. And I think this is probably for both candidates, how do you intend on advocating for primary health care nurse practitioners? And what is your understanding of those issues of the NPs and their concerns?
So maybe, Meredith, can we start with you this time to be the first one that would answer that question?
Certainly. It's a great question. NPs have come a long way, but the struggle with being accepted into a medical model has still been a challenge for them. I certainly do believe that they are a very unique group but have a huge voice. I also think that with the new bill, there is some and movement into acute care, but also community care. So family health teams have certainly given them an option, but it's not strong enough yet. They still need to be heard on different levels, and it really is a struggle to get into and change the medical model that most hospitals still live within. I think certainly with privileges of being expanding to admit and discharge out of the hospital from an acute care setting, I think community and healthcare have done a much better job of incorporating NPs into practice, but the acute care sector still needs some assistance. So I really think that that's a key piece for us to look at and continue to advocate for the changes. I think the legislation is catching up to where we need to be, but it certainly still has some room to have to be changed to accept the scope of practice for the NPs and really embed them into our acute care system, not just as specialists that they are, but also in our general acute care settings.
Thank you, Meredith. Allison, would you like to respond to that question?
Yes, so again, if we think back to our nursing practice framework, person, environment, health, and nursing, and we consider the environment of which NPs currently work in, and what some of the ideas that have been set forth in terms of where the beginnings and underpinnings of nursing and NP's role were. And oftentimes when you talk to primary health providers, they have this idea that nurse practitioners, the whole role was really evolved so that they could support rural areas in the community. And so we need to kind of start back there and do some mending of those fences, if you will, in terms of making people understand the great role of the NP in terms of supporting our healthcare system. So that's easy, right? We can say, okay, let's just support that, but it's much broader. We need to do it at all sectors, meaning not just primary care, but there are actually sectors within the community that could really use this role of NP to its fullest. They're not well represented in public health agencies. I know some public health agencies are moving towards using NPs, but there's still a major role for an NP within a public health sector, as well as many other community areas, in areas of mental health, in areas of community access, in supporting our emerge areas. And we do see NPs working in emerge, but I do believe that role could be broader. We might need to do some work between the College of Physicians and Surgeons and the RNAO and the College of Nurses to really have an understanding of what supports NPs really do have in terms of support for our healthcare system.
Thank you, Allison, for that response. Penny, are there any further questions?
Yes, there are, David. Just one moment, please. How both Allison and Meredith, please to respond. How would you support providing educational programs to frontline members that are affordable and accessible?
So, Allison, I will start with you this time.
Okay, well, this is a really good question, and we face this every day where I'm currently working, because I do a lot of education across the organization with nurses regarding practice, and it's always that idea of how can we manage the budget better, how could we make it look better across regions, but also across provinces. One of the things nursing practice leaders have done is to start a network of linking together, sharing educational support information. And one of the movements we want to see happen further is to develop educational tools and educational sessions that we can share across the province that do have those common bonds between them. So that's one way. But we do need to support continued education for frontline nurses. And one other way to do that is to create stronger links between practice settings and the academic world. And to create those links mean creating opportunities for nurses to, on an ongoing basis, stay connected and involved with nursing education.
Thank you, Allison. Meredith, I'll give you the opportunity to respond.
Thank you. I think Allison, just to follow up really on what Allison said, I think it's so important around the care continuum for and sectors for us to be able to provide that education. Allison was speaking about the PPNO and sharing educational things, and I think it's a great start. And we use it broadly. Unfortunately, not everybody has come on board with that particular. As we all know, has not everybody would like to share. But I really think that if we don't share, we're actually not doing a benefit to our or a service to our nurses. I really think that there are opportunities to collaborate more. I really do, as Allison said, across the sectors. We have different levels of practice, different standards of practice, and really different ways of being with our patients and our clients. And our frontline nurses really need that support. And unfortunately, most facilities are struggling with the availability. I know for us it absolutely is 100% about creating the space to even have the conversation. So I really think that maybe we should be looking at something from a provincial level through the RNAO, and I know the RNAO has courses and whatnot already available. We may need to be looking at something from a different standpoint. So an provincial-wide e-learning site where it is accessible for everyone who has computer access, although I know not everybody does consistently. But it might be a place for us to start.
Thank you, Meredith. Penny, back to you. Is there any further questions?
Yes, there is. Allison and Meredith, given the direction in healthcare in the community, what would your vision be to advance practice to the community?
Meredith, I will start with you this time.
Again, I think it really is collaborating and partnering with our community partners. I know that we have done a lot of work with assisting some of our community partners of looking at transitions of care and really how we can both learn from each other. Each sector is, again, very different in priorities, in levels of care, and I really think that if we don't start working together from acute care to community to public health to regional nursing, I really do believe that if we don't work on those collaborative relationships so we can help each other, then we won't advance practice, and we'll continue to have a large gap between current practice in an academic hospital to community hospitals to out in the community as well. I really think that we need to collaborate.
Thank you, Meredith. Allison, would you like to add to that?
And again, I agree with Meredith. We have a lot of silos in healthcare between the acute care sector, between the community sector, but also within those sectors themselves. Mm-hmm. Nursing practice is siloed to specific roles and practice types and settings. We need to break those walls down because at the end of the day, nursing practice principles should be applied in the same standard way, irregardless of the environment. We have to consider our patient, our client, but we also have to consider our base nursing practice principles and apply those principles across so that we can begin to break down the barriers. One other way that would strengthen the community in terms of is to look at the language that we use across community practice and across acute care practices, and make sure that our assessment language is tight and in line, and that we use standard assessment processes between acute and community care so that we're speaking the same language. That is one thing that I'm seeing that would be a big benefit in supporting community care.
Well, thank you, Penny. Just a housekeeping issue. What time are we available to go on till?
Actually, 11. I did just want to point out, David, to the people online and to the other candidates that Kelly Booth A third candidate is not participating in the webinars, but her information is available online on the One Member, One Vote site. Two other members that are running for the same position that Maria is running for, the member of the Resolutions Committee, Jane Hoon, I'm not sure how to pronounce her name. Apologies, Jane, if you're online. She's not available to participate because she has major workloads this week and she just cannot get access to a phone during her work schedule. Irene Molinar is actually overseas right now and won't be back, in fact, until Monday. So those are sort of apologies for people not participating.
Okay, so then we have till 11, so we're able to take further questions until 11. So, Penny, are there other questions?
There actually are no other questions.
Okay.
We might just ask if anybody else does have a last thought that they want to ask.
Sure. Marie, I'll start with you then. Do you have anything that you would like to add in, Maria, in terms of concluding comments?
I don't think I have anything further to add at this time. Thank you.
Thank you, Maria. Allison, would you like to make any concluding comments?
Just a comment. One thing didn't come up about how to embed research in our nursing practice and what order that goes in. And I just wanted to share this comment. As someone who works closely with nursing practice, sometimes research initiatives tend to drive nursing practice, and sometimes nursing practice drives research. So I just wanted to point that out to nurses, and I'm sure we are all well aware of that. But I always do like to kind of stand back and take that aha moment and say, okay, who's driving the bus and why? Why are we moving in this direction? So that's just sort of a reflective piece that I always like to discuss with any nurses, so I just wanted to bring that forward.
Thank you, Allison. And Meredith, any concluding comments that you would like to make? Hello, Meredith?
Oh, sorry. It helps if I turn off the mute button. Sorry. I just wanted to say thank you for the opportunity to participate.
Okay, thank you, Meredith. Well, Penny, I think that concludes our session. I will pass it off to you.
Thank you, David. Yes, that does conclude our session. We will have another session tomorrow at 6 p.m., and two of the other candidates will be joining us.
Okay, then I would like to thank everybody for participating in this webinar. Apologize for the few technical issues we've had. And I would also like to thank very much the candidates who have participated and shared this great session. So thank you all. Bye-bye.
Thank you.
Thank you.
Thank you.